Hi, good morning, good afternoon, everyone. It's our pleasure from the Global Health Advocacy Incubator to organize this webinar to talk about marketing restrictions and the key relevance that this policy has to protect the public health, particularly the right to children and adolescents, but the entire population. So we are going to have a wonderful panel today, and thank you for all the participants that joined the webinar. Let me introduce the panelists and also make an introduction of the topic and the goals for this webinar. We will have 1 hour and a half. The first hour will be a dialogue, a conversation with this panel, and then we will have time for questions and answers. Please use the question and answer function to make any questions or comment, and the chat only for technical issues. And let me introduce myself. I am Verónica Schoj, the Vice President of Food and Nutrition Policy in the Global Health Advocacy Incubator. As many of you know, the Global Health Advocacy Incubator, the incubator for all of us, is a global organization working in food policy, among other policies, to change the regulatory environment and promote legislation and regulation to protect public health from a population perspective. And why we are talking today, why this webinar about marketing restriction? Because we know the evidence is really strong about how aggressive is the marketing exposure to the population, but particularly to children and adolescents, and the impact that this marketing of unhealthy product, ultra-processed product, has in the health, increasing obesity, increasing NCDs, diabetes, hypertension, and even mortality, and how this aggressive marketing influence purchase behavior, consumers' behavior, and even more in very little, very young children, how influence their consumption, but also the loyalty to brands, and how this could remain for the entire life. So the evidence is so strong that there is a clear statement coming from many international bodies how this aggressive marketing of ultra-processed products violates several human rights: the right to adequate food, the right to information, the right to health. And children and adolescents are particularly vulnerable, but also the more poor population are more exposed to these aggressive marketing strategies. But also the complexity of the marketing. We don't have only the traditional marketing strategies. We have advertising, promotion, and sponsorship with very innovative strategies. And we are going to discuss with the panel what we are talking about when we talk about marketing. And the complexity of that. But also, we organize this webinar as the first of a series of webinars because we want to discuss what are the challenges and opportunities, because we see that marketing restrictions are moving forward, are progressing slower than expected. And we want to analyze the reasons, which are the challenges, why we are not moving forward, why we have the evidence. We didn't find the tools to effectively protect the population for unhealthy products marketing, and to create the urgency to move forward faster. So I am going to present the panelists. We are going to share this panel and this roundtable today with María Suárez from FIAN International. María is a lawyer de la Universidad Javeriana, University Javeriana de Colombia. She has a postgraduate in public policy in la Universidad de los Andes de Colombia, and a legal master degree from the University of Heidelberg, and a doctorate from the University of Mannheim in Germany. She is the coordinator of FIAN International and representative for the UN in Geneva from her organization. She has been working in many substantive international declarations and legal documents, and one of the most relevant related to this webinar is the current negotiation process toward binding instruments on transnational corporations and other business enterprises with regard to human rights. Ana María has worked closely with communities affected by violation of their rights to food in various regions, supporting them to use the accountability mechanism in the UN human rights system and the Inter-American human rights system. So Ana María, very much welcome. We also have Laura Michéle, also from FIAN International. Laura Michéle coordinates FIAN International work in nutrition and food system. Her main interest and focus of work are the corporate capture of nutrition and food system and transformation toward healthy, sustainable, and just food system. We also have in this panel Corinna Schoj, Professor Corinna Schoj from University of London. Welcome, Corinna, as well. Corinna is a professor. She is the director of the Center for Food Policy at City University of London in United Kingdom, a center dedicated to improving food policy to shape a more effective food system. Corinna has worked for over 20 years with UN agencies, government, NGOs, universities, national and international level to support the design of more effective actions through food system and to improve diets and prevent malnutrition, obesity, and non-communicable diseases. She also co-chairs the Think 20, a task force on food security and sustainable agriculture, a distinguished fellow at the Schoj Institute for Global Health and chair of board of Bite Back 2030, a movement of young people fighting for better food system. In 2020, she founded the Nutrition and Food System Leadership Initiative. We also have Camila Corvalán. Camila Corvalán from the University of Chile and INTA. Camila is a doctor, is a surgeon, and has a master in public health and a PhD in nutrition. She is the director of the Center for Research in Food Environment and the Prevention of Chronic Disease Associated with Nutrition, CIAPEC, at the Public Health Unit of the Institute of Nutrition and Food Technology in INTA of the University of Chile. And CIAPEC is dedicated in the population study of early nutrition determinants of obesity and associated chronic diseases, particularly metabolic diseases and breast cancer. Their work focuses in carrying out longitudinal epidemiological studies, both observational and intervention, in stages considered critical for the appearance of these diseases, such as pregnancy, childhood, and adolescence, considering various determinant factors in both environment and food as individuals. CIAPEC is part of the international network Informas for monitoring environment, and also carry out descriptive population studies and evaluation of public policies such as Chilean labeling law, together with advising Chilean public bodies. Again, welcome, Camila, to the panel. And last, I am going to introduce Fernanda Mediano. Fernanda is from the University of North Carolina at Chapel Hill. Fernanda is a psychologist with a master in health psychology and a PhD in media and communication. She is currently a postdoctoral researcher at the Global Food Research Program in the University of North Carolina. She is interested in studying the environmental and psychological determinants of the population's nutritional health. And currently, her research focuses on the effect of food marketing and its regulation on children and vulnerable population attitude, beliefs, and behavior. So welcome all of you. As I mentioned, please, for the audience, send any comments to the questions and answers function. So this will be interactive. We will have some polls, opinion polls to engage the audience and participating in some key questions, and the panel is going to answer. So before jumping to the discussion and the questions, I will invite all of you, starting with María, to briefly introduce yourself and connecting your background and huge experience with the topic we are going to discuss today about marketing. Go ahead, María.
Yeah, thank you very much, Vero. I think that, of course, being an activist on the right to food that goes from the seed to the plate and from the plate to us, marketing is very important and is a condition for adequate food. And this is a way in how we, or I have been connected. Marketing is also related to accountability, because we see how the marketing causes in some situations misleading information for people, therefore increasing harm. And since I have been working on accountability of transnational corporations and other businesses in general, marketing would be one of the little boxes between this big closet that I have been working. Then it is also very related to the advocacy work that I have been doing, for example, with treaty bodies in the reports that we have presented with our sections, for example, from Colombia or Brazil. Already many years ago, we were speaking about the misleading messages of marketing and the consequences on the right to food. And now we are more connected to other special rapporteurs, like the special rapporteurs on toxics, on health. And this also includes all this work, both with treaty bodies and special procedures of the UN. I have also been supporting FIAN Colombia for advocacy work with the WHO, the World Health Organization, here in Geneva regarding marketing. And my older experience was around 2007, when I was contributing to the preparation of the first human right to food monitoring tool of FIAN, and we also had some questions on marketing and misleading publicity. So I think that's what I recall. Thank you very much, Vero.
Thank you, Ana. Thank you. This is very relevant. Please, Laura, go ahead with a brief introduction and your background.
Yes, thank you very much, Vero, also for inviting us to this panel. So yes, I guess a core component of our work at FIAN International in the area of nutrition and food systems is really sort of developing this holistic vision for transforming food systems in line with the right to food. And as part of that, also supporting and linking different struggles on the ground that are pushing for the realization of the right to food and the transformation of food systems in this direction. And yes, since marketing is really one of the main strategies, I guess, of the industry food system to market its products, its unhealthy products, which give it its widest margin of profit, it's also a key component, or it plays a key role in the transformation of food systems. Yes, thank you.
Thank you very much, Laura. Corinna, please go ahead with your introduction.
Sure, and Hawk, thanks very much for the kind invitation to participate today. It's great to be here. I've been working in the area of marketing policy for quite a long time. I was chair of the WHO committee back in 2008. That led to the WHO recommendations on food marketing to children. And been tracking policies in various ways since then, and I've also done some work trying to communicate and to study and to understand why marketing is just so important as a driver of modern food systems, and why it's so important, therefore, to pay attention to it. Most recently, the work that my colleagues and I do at the Centre for Food Policy is around lived experience of food and food environments. And we find, as part of that work, just how exploitative unhealthy food marketing is of children, and particularly their mothers, in the sense of the way that it creates aspiration for people who have otherwise very little, the way that it exploits women's desire to love their children and to show love for their children. And it only ever gets worse the more one digs into the role of food marketing to children and how it negatively plays out in the realities of people's lives. Thank you.
Thank you. Thank you a lot, Corinna. This is really amazing. Camila, please go ahead, introduce yourself, how you have been working in relation to this topic.
Yeah, hello everyone. Thank you very much for the invitation. I'm very happy to be here. I'm a researcher at INTA, University of Chile, and I have been basically working on evaluating a set of policies implemented in Chile that include a very extensive marketing regulation toward children. So based on that work, we have had the opportunity of really reflecting a lot on some concepts, the difficulties of moving forward with this kind of policies, monitoring, and also the difficulties associated to evaluating the impact of this kind of policy. So very happy to be here and discuss with all of you.
Thank you. Thank you a lot. And last, Fernanda, please go ahead with your introduction.
Hi to everyone. Thank you for this invitation. I'm very, very happy to be able to talk to all of you. Well, I am a psychologist. I started working in primary care, in a primary care center, and then things moved me, and I started working in the Ministry of Health, and I was part of the team that developed the food marketing part of the food marketing regulation. So during that experience, I realized I wanted to learn more, to understand more how the food environment impact our food behaviors and our health, and especially marketing and communication in general. So I did my PhD in media and communication, and since then I started working with the team at UNC and INTA in the University of Chile, doing research about the impact of our Chilean regulation. And then also I am very interested in trying to understand more of the mechanisms that are involved in this, and how the food environment in relation to psychosocial factors actually impact us, and how to I really am interested in creating more evidence that hopefully can help us to improve our food environment through structural policies. Thank you for the invitation.
Thank you a lot, all of you. Well, we will jump into the questions to discuss. Please, for the audience, make comments. As I mentioned, we will develop a couple of polls to engage the audience with some of the key questions we want to discuss with the panelists. So to start with the first question, I will ask Corinna and then Camila about what has been in your experience, and based on the research you have been doing and the experience in many countries, what have been some of the main challenges and obstacles to achieve effective policies that reduce children and adolescent exposure to ultra-processed product marketing? Corinna, if you want to start.
Sure, thank you. I'll leave the specific case, of course, of Chile to Camila to give a general sense of what the challenges are. The challenge of regulating of policies is to do with the number of details that need to be worked out when designing these kinds of policies, and not least the target audience, the foods which are covered, and the channels of communication which are covered. Obviously, marketing is everywhere, and it is purposefully designed by food companies and their advertising and communications agencies to be integrated campaigns which get their finger everywhere. And so the question is, when you're designing, when one is designing a restriction and a regulation, is what foods to cover, all of these details, which I know we'll be talking about later on. And they've done a wonderful example of that in Chile, but every country has to kind of go through this process. And we don't have any kind of global standard on what this should look like. That's the first issue. So it means that the capacity that it takes to develop these details in the regulation really takes time and effort and investment. And the second issue that plays into that is because there is all of these details that need to be worked out. That means that what happens is that the food industry and the advertising industry, which opposes regulations, come right in and start to kind of address some of these details, like, oh, you know, if you have that nutrient profiling model, then it's going to cover walnuts or avocados and they're healthy, so what's your problem? And no, it should only target children, not adults. So immediately kind of get into this war with the food industry, and who are then, of course, lobbying everybody left, right, and centre, which is, of course, it goes out with saying a huge challenge. And the whole vision of what we're trying to do when we're regulating marketing to children gets lost. The reality is, it is just wrong that we live in a world where children are exposed to unhealthy food marketing. It's just crazy from every angle you can think about it. But that basic vision of what we're doing this and what we're in this for gets completely distracted by all of these arguments about the details, which then, as I said, slows things down, but it's also exhausting. It means that the people, often women, who are working in government at any level or working in whatever capacity they are in advocacy as well, to try and get these regulations passed, get burned out by the process of having to deal with these arguments about the details. So what that means is that you end up with a kind of a freeze on the development of regulation, the exhaustion of having to deal with the opposition, the exhaustion of having to deal with getting all of these details worked out. And there isn't enough capacity and resources in the system to support that. I mean, of course, there's fantastic resources that you are providing and others, but there's not enough globally to really make that happen. So, and what we lack is a real global advocacy movement that is a global movement that is designed to share lessons, to share capacity, to build resources in order to enable this change to happen. And that in itself is a challenge and a barrier to moving forward effectively in this space. I'll end there and pass. Thank you.
Yeah, thank you. We can continue. You put a lot of things to go in more detail later. Thank you. Camila, please go ahead with your experience about challenges to implement marketing regulation.
Yeah, I think that Corinna put it very, very nicely. The thing is that when we have to move into passing policies, we need to get into details. And in the case of marketing, the details are enormous. I mean, there are infinite ways of really marketing products, marketing demand, sponsor things. So it's really an ending story. In the case of Chile, the way that we deal with this was that the Ministry of Health convened a set of experts that had to work in actually defining all the details of the law and work through all the specifics to make it happen. Of course, based on the best available evidence. And then there were recommendations made to the Ministry of Health. But it was really a lot of work. There were loopholes. In Chile, a law was originally passed that it restricted marketing based on audience to programs, but then we had to go ahead and really use a more broader regulation because that was not really covering what we were expecting. So a number of difficulties. I think that Fernanda maybe can comment more on this, but also how do we define marketing toward children is a very tricky issue, because we all know that marketing really, it's pervasive, it's everywhere. When we talk to mothers, we are actually talking to children. So very tricky to define or direct our regulation only to children. I also want to comment that there are difficulties in terms of passing this kind of laws, because we are not really monitoring or collecting systematic information regarding these issues. And I think this is something that it's improving recently, but it's something in which we still need to work more. We countries, advocates, researchers need to understand that we need to be collecting data to be able to pass regulations, to enforce those regulations, and to make policymakers accountable of what they have done. So I think we need to work on that. We need to be monitoring corporates, we need to be monitoring policies, and that's an area in which we should be working much more, as Corinna said, together, because probably it's going to be impossible to cover everything from one single country or view. So this really requires collective action.
Great, thank you very much for these comments. Summarizing what you were, both of you, Corinna and Camila, were talking about, you were talking about the lack of global standards that are a challenge as important as industry interference, and how complex is the fact that we need a lot of details in the design. Not any policy is effective enough, because we need a lot of detail defined with standards that are clearly effective to define target audiences, products that are being part of the scope of the regulation, communication channels, how tricky it could be to define the targeted to children, and based on the Chilean experience, how loopholes in the law demonstrated that the regulation was not comprehensive enough and had to be modified. So, and the lack of data and experiences to achieve these global standards, the tools we need to be more effective. So with that introduction, I would invite Kathy to engage the audience with a key question that is connected with something that both of you mentioned, that is the target audience. So we invite all the participants to complete one of these two options. Who should be the target audience for a marketing restriction? Just directed to children, or the marketing restriction should be directed to adults and children? Based on what you know, your experience in your countries, what our panelists have just said, we are given only 1 minute to complete the poll. And some of the examples, one of the comments in the chat was about formula milk, for instance, and that is a clear example that the marketing is targeting mothers, parents in general, professionals, but clearly the violation of the right to breastfeeding is affecting babies, but they are not the main audience of the marketing. So we will give you a couple of seconds more. So Kathy, if you show the results, we can see that 75% of the audience think that marketing restrictions should include both adults and children, and 25% only children. And this is a discussion that I would like to have the reaction in the following interventions, that one thing that we want to protect this vulnerable population that are children and adolescents is a completely different concept, that the only marketing we should restrict is those targeting children. So maybe you can, Corinna and Camila, make a short reaction of the answer of the audience about this question. Go ahead.
So I think this is a good result to see that most think that adults and children should be targeted. And I think that's important for two reasons. And one is that the evidence is quite clear that it is exposure and the power, but also the exposure to marketing that is so important. So if that marketing is targeted to adults for an unhealthy food, then and children see it, then that needs to be restricted because children are still seeing it. So the target should be anything that is viewed by children. And so if they're so when they're in a park or watching TV or whatever it is, if they see adult directed advertising, they are still exposed to the advertising. And the second thing is that what the companies have done is to redirect their what they define as child directed advertising to the caregivers of children. And that's very clear, it's very deliberate. And so it's the same products, but it's somehow defined in industry terms as targeting the parents, but that means the parents are still going to purchase it, and there is evidence on that, obviously, to show that it influences purchases. So that's why it's important to take a very strict and restrictive approach to this, to make sure that we're fully protecting children. And of course, the food industry are absolutely against this. A red line for them is that we will only, in their voluntary agreements, only do things which are directly targeted to children. And so it's a red line, and it's a red line that needs to be broken through good regulation.
Thank you, Corinna. And I am going to continue with a question for you, Ana María, based on your vast experience in human rights and international human rights law. How do you think the human rights resources, laws, and international law, and particularly how they could influence the better quality and better standards for marketing restrictions, and particularly how can international advocacy work around corporate accountability, as you mentioned before, could help advance struggles at country level on the regulation of marketing? What are some lessons learned with regard to ensuring corporate accountability across food systems?
Thank you, Vero. I think I will do the two last questions because my colleague Laura will be speaking more about the important role of the human rights in this. But first of all, I want to say that I am very pleased to be here, also to see so many strong women, because in the work towards the Treaty on Business and Human Rights we are negotiating here at the UN, also many of the leaders are women. I think that I will focus especially on the regulation of business and human rights, because this is a new space that, let's say, we have entered to show how we cannot fragment our struggles. Sometimes when we just focus, for example, in one aspect, like marketing, then the companies find another way to continue the behavior, to continue doing harm, not necessarily solving the problem, even if we have put a lot of energy on the topics. And in this sense, I think that working on the specific topics, but also on the framework topics, is very important. And therefore, the treaty on what I call on corporate accountability in general should have impacts that are good for all the work on marketing. I think in this framework of the regulatory processes on businesses accountability that are happening not just at the global level, but also, for example, in the European Union or in many countries at the national level, including Colombia, Brazil, Peru, and others, the issue of marketing and the impact of ultra-processed food could be an issue to show how companies are producing harm and how difficult it is to regulate due to what we in the civil society in this area called corporate capture. We went beyond the term you normally use of corporate interference, because we think that now all the governance spaces are extremely influenced, so that we do not have power of decision and influence in them. And this is bringing market to these processes is also important, because most of the work has been done on extractive industries. And this is also relevant, but in many cases, the harm that is produced, for example, for the urban populations, are not visible in this kind of processes. So it has the potential to give more visibility to the topic of marketing, but also to make stronger the regulation of companies, because it shows that the harm is not just for the poor people in the rural areas, but for any one of us who eat what is advertised in a misleading way. I think that, for example, it would be interesting to have documents like for example, the study that Guy published the last year to make visible all these harms, and that you could also use the networks that we have created around the Treaty on TNCs and Human Rights to denounce the corporate capture in the legislative process for the marketing of ultra-processed food. And of course, participate in our networks, side events, etc. And that would help us to bring more convergence in civil society. Sometimes the best tool that the companies have to impede that we get our aims is to divide us. And therefore, we need to be together and overcome this fragmentation. And then maybe quickly on the lessons learned, we have learned that voluntary approaches are not enough. So what we negotiate as codes of conduct or ethical codes are easy for the soft cases, but not for the hard cases, and not when it represents a big loss for the profit of the companies. We have learned that using justiciability mechanisms, claim mechanisms can be good, but we need collective remedy mechanisms. It's not enough to claim case by case, and I think in the issue of marketing, that's extremely important, the collective complaints. Then we have also learned that to prevent the harm, for example, of ultra-processed food, not only due diligence is useful, because due diligence, as it is now in the regulation, is defined by the same companies. So they say, okay, I see these risks, and then if they do not comply in preventing the risks that they saw, they are liable. But if it is other risks that they do not want to see, then they are not liable. And we think, therefore, that we need to go far beyond due diligence and ensure real prevention, and that the liability of the harm produced by companies should be based on the harm and not only on the due diligence. And this is very important in the case of marketing, because in many cases you can achieve the marketing but not the sanctions for the company. And if you do not get the punishment, then the law will be ineffective. And what is also interesting for us in our work is that sometimes when we just focus on the national legislation, it's not enough, because the economic pressure of the corporations and the consumption system is so big that the laws result ineffective, or the governments do not take all the steps that they need to implement the regulation, because the economic pressure is bigger than the power of the law. So we need to think in an extraterritorial context where also global regulations are relevant. And it includes also global regulations that can change, for example, food systems. And Laura will go more in deep into that. And now to finish, we also think that it is very important to connect the struggles, for example, the peasants, with the people, the consumers, because of course, if we have good advertising and nobody else wants to eat the ultra processed food, it will not be enough. You can have bad food available. You can lack of, for example, adequate prices that make the food accessible. And therefore, looking just in one of the aspects where we see the violations and we need liability may become ineffective if the situation is not tackled in a more holistic way. And this is exactly what Laura will explain to you later.
Thank you, Anna. This was wonderful. I want to highlight the fact that you are saying that this international business and human rights treaty that is being discussed is a huge opportunity, and we as a global community could take advantage of that to try to push for the agenda of marketing of unhealthy ultra-processed products, because it's clear that the extractive industry has been more in the focus of the conversation, and we have here a huge opportunity as a global community to advocate for that. So that is, we really appreciate that FIAN is leading this movement and putting a lot of efforts to incorporate this issue in the agenda. I also want to highlight the comment you mentioned about corporate capture as something more powerful and comprehensive as compared with industry interference. And we completely agree about that, how that capture in the government, in the civil society, in the media is influencing every single space and opposing the public interest. So I also appreciate that. Also, I want to highlight the fact that this is a space to reinforce that voluntary agreements are not useful, and how we could use this and other tools to make the corporations accountable and the due diligence that is necessary to implement and enforce the marketing laws in any country. So thank you for all these comments. We will continue with Laura about human rights. And now I am going, yes, please go ahead.
May I do only one comment? The process of the treaty is very important, but it's also a very difficult process. So I cannot promise you that with this we will solve everything.
I know.
But the process is important because we can make our struggles visible, right? And we hope that the general rules that we will get there are useful for our specific topic. So we will not get a rule on marketing. This will be almost impossible, but what you get there will be useful for your work on marketing, only to not create false expectations.
This is a very important clarification. It's something more, as you explain, more comprehensive, analytic, and not directly, but completely useful to be applied for marketing and other regulations to improve food systems. Thank you for the clarification. It's very important. I am going to invite Kathy to develop the second question. We were talking about target audiences, and our audience clearly showed that it's important to that the target audience is not only children but also adults. We have a second question that also was mentioned before by Camila and Corinna about the communication channels and how comprehensive should be marketing regulation. So we wanted to ask you, to the entire audience. We have more than 100 participants today, and thank you for joining us. Please let us know what is your opinion about if we should move forward with a complete ban, including every way of advertising, promotion, and sponsorship strategy, like we have in the framework convention for tobacco control or for alcohol, where the ban is complete, including, as I mentioned, sponsorship, corporate social responsibility, and not only brand marketing, but also corporate branding. Or if you consider the second option, like a comprehensive ban, including most, but not necessarily all, the strategies or the corporate sponsorship or all the channels, but comprehensive enough. Or if you think that a partial restriction, for instance, the most common example around the globe is television restrictions in times where children are exposed in the television, or strategies about cartoons, or clear strategies addressed to children in packaged food. like a partial restriction. So we have a minute to complete one of the three options to see what our audience is thinking about that. And then we will invite a couple of panelists to react and to think about, based on their experience and the evidence, what do you think is the most recommended approach to have an effective marketing restriction. So Kathy is going to show us the result. So we can see that nobody voted for a partial restriction, which is great. Of course, our audience may be biased with a lot of experts, but in any case, it's good to see that. But we see that 81% is talking about a complete ban, emulating maybe the FCTC, and around 20% was talking about a comprehensive ban, including most, but not necessarily all, the channels and strategies. So to continue with that, I will invite Fernanda to make comments about how comprehensive should be a restriction based on your experience as a researcher and the evidence. And after Fernanda, we will invite also Corinna to make some comments about the level of comprehensiveness should be recommended. Fernanda, please go ahead.
Thanks. Okay, so first I think maybe we need to think a little bit about how marketing works. So what companies do is just like to put together a emotional, like a positive emotion or a social value together with a product. So for instance, like happiness and friendship with a soda. And that message, they send it to a specific audience and they try to reach us through all the channels they can. And they want to reach us also as many times as possible. And the goal is that we learn that message and we have that information available to influence us when we are doing food choices. So if we think about that, in order to reduce exposure to unhealthy food marketing, we need to have comprehensive restrictions, probably to cover all the channels possible. So we are talking about traditional media, internet, but also public places, schools, maybe the areas around the schools, and why not to think about public institutions. And also we are talking about packages and everything that is happening in the point of purchase. But also if we think about the strategies, also if we want to reduce the persuasive power of marketing, we need to try to cover as much as possible. So appeals that are attractive for children, for adolescents, but also any type of gift content or any strategy to engage with the audience and to reinforce their behavior, it's important to cover. And then all that sounds incredible, but it's very difficult. So if we need to prioritize, we need to think about where children and adolescents spend most of the time. And today they spend most of the time in internet, in YouTube, and in social media. So probably that is our priority now. But given the marketing work with these integrated campaigns that they are trying to reach us through different channels, of course the ideal situation is to have the most comprehensive regulations. And also something that I wanted to discuss a little bit is when we think about each of the channels, how we approach that. So for instance, in the experience we have in Chile, if we think about our experience related to advertising in television, we have a stepwise approach, but it tried to cover as much as possible the power, restricting child-directed appeals, and also exposure with restrictions of any type of unhealthy food advertising in specific programs that were targeting children. But also in the second phase, we have this strong daytime restriction in which any advertising of unhealthy food was not allowed to be aired from 6 to 10 p.m. And of course, we know that is the best for this media. But these small restrictions also complement with the daytime restriction, because we know, at least in Chile, for instance, around 25% of what children watch in television, they watch it after 10 p.m. So in that case, we need to have these different regulations and different approach that allow us to actually reduce as much as possible exposure in television. And I think that example in Chile, that we of course need to improve it and improve each of these like part of the regulation, but that structure is what I think we need to try to develop for each of the media. So for instance, what is happening now in the UK, and I guess Corinna can talk about that now, is they are trying to discuss how to have this combination of different regulations to reduce exposure in internet, which is very, very challenging. But yeah, so as a summary, I do agree that we need to try to cover all the channels possible, all the strategies possible, thinking about protection of children, like, I mean, from 18 years old and under, because children and adolescents are very vulnerable. And yeah, if we need to prioritize, we need to think where are children now getting most of the marketing.
Thank you a lot, Fernanda. This was amazing. Corinna, please.
Well, Fernanda covered much of it. Thanks very much for that. And I agree with absolutely everything that she said. To pick up on a couple of points that she made about point of purchase and packaging, that if you analyze the voluntary approaches taken by companies, at least the ones that they initially developed, packaging was never included, with one exception of one company that added it later. And packaging is really incredibly powerful at point of purchase, as is anything at point of purchase. So even for caregivers and for kids who are saying, I'm going to resist this marketing, or they're perhaps aware of it, and which of course it's impossible to be completely aware of it, since it slips into our unconscious thinking, is the intention. But it really then becomes difficult at point of purchase. However high your intention, it's so easy for your high level of intention to be undermined by marketing at point of purchase. And the way that packaging creates aspiration, and that these are the better products and so on for children. So for me, I think that packaging is particularly important. It's part of the product. And the design of packaging is part of the design of the product in the first place. So if packaging wasn't allowed in ultra-processed foods and unhealthy foods, then there would be a pause in the company to say, well, do we want to design the product in the first place? Because if we're not allowed to put packaging on it, the kind of child-friendly packaging and caregiver mum-friendly packaging, then is it really worth it? Because we're not going to be able to sell it. So I think packaging is particularly powerful, and I'd love to see a plain packaging approach of the way that's taken to tobacco, taken also to these ultra processed foods targeted at children as well. Thank you.
Thank you a lot, Corinna. Camila, you have a comment to add? Yeah,
very briefly. I think this is not necessarily related to channels, but to settings. I trying to be positive and optimistic. I think that something in which we cannot give up regarding marketing is school and daycare environments. I think that we really have an opportunity of getting those spaces at least free of this kind of interference. I think we need to work more strongly on providing a safety, healthy environment for kids over there. And I think that that's a must, and it's an opportunity for really making progress without getting with all the complexities of all the other different venues. But I think that that's something that we need to be very, very strong about. In Chile, we have a very strong evidence showing that strong effects, positive effects of the regulation came through school environments by restricting the access to these kind of foods, restricting marketing, providing very strong messages to kids through these venues. So I just wanted to emphasize that I think that there are opportunities there, and I think that we as a community need to be very strong about not allowing marketing of unhealthy food products in those settings anymore. And I see an opportunity of moving forward on that arena easier, maybe than in others.
Thank you a lot for the 3 interventions. They were really great. Some comments I would like to highlight related to the fact that all of us agree that the regulations should be as comprehensive as possible, that is clear. And we talk about channels and strategies as comprehensive as possible in every channel, but also every strategy, including corporate social responsibility or promotions, or not only the direct marketing or the traditional marketing, also the complexity we have with digital new channels and the one-on-one direct marketing below the line strategy that is much more invisible. But also, so we agree on that. And also some of you mentioned that we need very good standards for each of these channels because are not equal, are not necessarily comparable. So we need very well-designed standards and narratives in the legislation or regulations to address all of them. But you, Camila, introduced another concept because we have been talking about target audiences, about channels, about different marketing strategies, but you also talk about the environment. So the dimension to protect some specific environments more comprehensively or complete ban, at least for instance, in schools or some other environments, according to the evidence you had in Chile. So if we have some time in the discussion, I would love to hear more from you about the evidence generated in Chile and how you think could be useful for other countries. So now I would like to ask Laura about the human rights approach and what do you think, Laura, what role can human rights play in advancing marketing regulation? How can we use human rights to achieve effective changes in society which allow better food quality for better health, upgrading the impact of marketing regulation and improving the standard using those international human rights legal frameworks? Please, Laura, go ahead.
Yes, sorry, just one moment. Yes, thank you very much, Vero. And I think it feeds also into a lot of things that other people have already said. Yeah. So the promotion of unhealthy food products through marketing by food companies fundamentally interferes with the enjoyment of human rights. I think all of us here agree on that, including the right to food and nutrition, the right to health, but also the right to information. So besides these direct effects on the enjoyment of human rights of the people exposed to food marketing who then change their sort of consumption habits because of marketing, it is also one of the driving motors of the industrial food system and its production model, a model that is built on the destruction of our planet, destruction of local food systems, knowledge, biodiversity, and the exploitation of the very people who produce our food, the peasants and the food systems workers. So hence the system as a whole that's sustained by marketing is linked to multiple human rights violations. The International Human Rights Framework establishes legal obligations on states to respect, protect, and fulfill human rights. And these are obligations that states themselves, at the moment that they ratify the international treaties, they have accepted to be bound by. So in this sense, human rights are a powerful tool for the struggles related to healthy diets because we can base all our advocacy on something, on obligations that states themselves have committed to fulfill. And further, the rights and obligations enshrined in international treaties, some of them are quite vague, but they're further clarified by the different human rights bodies in charge of monitoring their implementation, both through what is called general comments, but also specific recommendations to states, which in turn is again complemented by the reports of special rapporteurs and independent experts on specific issues. So the different human rights bodies, and I think it's especially the Committee on the Rights of the Child, have on several occasions underlined the need for governments to establish marketing regulations. especially to children, but also, since we just had this question, also to adults as part of their human rights obligations. And they've been making reference to several rights, including the right to health, adequate food and nutrition, survival, development, but also, for example, non-discrimination because of the specific vulnerability that children find themselves in. In addition to these specific calls for marketing regulation and related measures, such as, for example, also restricting the availability of unhealthy food, for example, in schools and other public environments, or sponsorship of sporting events, etc., there are also several general principles that are laid out in the Convention on the Rights of the Child, but also other human rights conventions that can help us in our advocacy in relation to marketing regulation. One of them is the concept of children as rights holders, that children are not just objects of law, but in fact, they're rights holders and their rights need to be protected. And the Child Rights Convention makes clear that the best interest of the child should be a primary concern in every policies and every actions governments take that relate to children. And they should supersede, for example, economic concerns. Secondly, human rights make a very clear distinction between rights holders and third parties, and I think Anna Maria already referred to that, which third party would be corporations. And I think this is very relevant when it comes precisely to the policy processes in which marketing regulations or other regulations are being discussed. So for human rights, it's clear that the participation should be for rights holders and those groups supporting rights holders, but not for the corporations who come with an economic interest. So I think it can be very helpful in advancing sort of clear distinction of roles and preventing corporate influence and interference in these policy processes. So as mentioned earlier, marketing of unhealthy food not only has direct impacts on the health and rights of those who consume the food, but also broader food systems implications. And in this sense, yes, ultra-processed foods are probably the most profitable for the food industry. And I think how Corinna was saying, probably if they would have to let go of the packaging and the advertisement, they might not even have an incentive to produce these products anymore and sell them. So in a way, unhealthy food marketing is a lifeline for the food industry and the industrial food system. And vice versa, marketing regulations can also play an important role in the broader struggles to transform food systems. So in this sense, human rights can serve us not only as a legal tool in advancing concrete struggles, such as marketing regulations, but they can also really help us think more systemically and holistically, and thereby develop better strategies that connect rather than isolate the different struggles, and thereby making them much more effective. And I think Anna also already talked a lot about this. So a cornerstone of international human rights is that all human rights are indivisible and interconnected, because their purpose is really to preserve human dignity. So you can't detach human rights or say that one is more important than the other, or you start with one and then you deal with the other. One right really feeds into another. So it's impossible for us to think about health without thinking about food, or thinking about food without thinking about land to grow that food. So while some aspects may be more pressing, we should not be prioritizing or isolating them, or we might even end up harming a particular group of people as we try to realize the rights of another. So for example, if we put an excessive focus on consumers and their access to cheap, healthy food, for example, we might end up harming the farmers who produce this food and who receive even lower prices for their food in the end. So UN special rapporteurs especially on the right to health, but also the right to food, but also the right to a healthy environment. They've increasingly also emphasizing the need for a food systems approach to realize the right to food. And an approach that really connects the various dimensions of the right to food. So for example, sustainability and nutritional adequacy, that they should not be looked in isolation, as well as the interrelations with other rights. And I mentioned some, like the rights to land or the right to decent work. And they've made several concrete recommendations in this regard, like what are the steps that states should take to foster this transformation of food systems to realize human rights. And a lot of it is based on the realization of agroecology as a way of really holistically realizing the right to food and other related rights. And I don't have time to go into the recommendations, but just perhaps to say that, yes, human rights can help us in developing this broader vision for food systems transformation that combines public health, environment, but also justice concerns. And it doesn't necessarily mean that we have to do everything, because sometimes it can seem overwhelming if we take this holistic vision, but it really just means that we have this holistic vision in every action that we take. And that way we end up all pulling on the same string. And it also has a really good connecting force that way also, yes, supporting the individual struggles in a way because we connect them towards a common goal. So in conclusion, human rights can help us in providing force to our advocacy and giving us the legal underpinning for the arguments we use. It can help us argue and overcome specific hurdles, such as the participation or the corporate capture by the food industry of policy processes. And it can help us think holistically and thereby have a more transformative impact. Thank you very much.
Thank you, Laura. This was amazing and really very comprehensive. I think it's absolutely right that the human rights body, international body of laws and recommendations and regulations and rapporteur declarations are not just to resolve specific struggles in the marketing issue, are more an holistic framework, but it's extremely useful to frame these policies as human rights policies, but also to have some specific, there are some specific guidance, like when we talk about children, we are talking about 18 or below and not 12, like industry promotes, or for instance, self-regulation is not useful, or things that are very pragmatic, and others that are much more holistic and comprehensive, that are extremely useful to frame these policies and also to protect them from litigation, because we know that industry always challenge these policies with arguments of freedom of commerce or speech, and framing these policies under the human rights umbrella is extremely powerful to protect them as rights that are superior as compared with freedom of commerce, for instance. So I really appreciate all the intervention and comments. Any other comments about the human rights approach from the rest of the panel, or any reaction? Because otherwise we can open the floor for answering the questions to the audience. We have now 20 minutes to answer questions from the audience. Thank you to the audience, because we received a lot of questions. We are going to choose some of them, but we can commit to send answers or continue this conversation in the future. As I mentioned, this is the first of a series of webinars to address marketing issues. So do you have any other comments from the panel? Please go ahead if you have something to add. Okay, so we can start. Yes, Corinna, you have a comment? No, okay. I will start with some of the questions from the audience. One of the questions is, for instance, what do you think, the panelists, about integrating marketing of all harmful substances, not only ultra-processed products, but also alcohol, or other, or tobacco or other products, in comprehensive marketing restrictions, including all these harmful products for health? If any of you want to answer based on the experience, would be strategic or not? What do you think about that?
Well,
Corinna?
maybe.
Corinna and then Camila, yes.
Okay, I'll just be quick. Yeah, just to say that I think there's a need for collective bringing together of a collective of people concerned with different forms of harmful marketing, including the marketing that was mentioned in the question, and that the larger the community, the more powerful it can be. But of course, there does need to be a particular community who's focused on the specifics of food marketing. But one place to start is to bring together the work on advocacy against food marketing to children with the breast milk substitutes, marketing of breast milk substitutes, because that has been around for a long time. There's a World Health Organization code on the marketing of breast milk substitutes. The enormous challenges with the advocacy community in making sure that that's implemented is quite trying to read, in the sense that it's been very difficult to have that implemented. But by joining forces, I think the movement will become more powerful. Thank you.
Thank you, Camila.
Yeah, very briefly, trying to comment that in Chile, we have been working in trying to establish this partnership and to come together, talking about unhealthy commodities, joining unhealthy foods to tobacco and alcohol. I think in each country there are progress in some areas that can be shared to the others, and the set of policies really that we should be working on are very similar, and we could work together and make some progress. Something, however, to keep in mind on this is that unhealthy foods do have a safe, I mean, it's not exactly the same that tobacco and alcohol. And this is something that comes back to us in every single policies that we try to pass, because there is no safe limit for alcohol consumption and tobacco consumption, but that's not the case for food. And we need to understand this, because these set up a stage in which making progress, it's much more difficult. That's why I tend to think that when we really try to make things happen, defining some environments might be a way to start to have some progress. But a number of challenge on moving, I mean, on moving in specific actions. Yeah, the other thing I wanted to comment that I don't know if it's related to alcohol, and it's the fact that here, when we talk about marketing, we are really talking about the heart of this economic system. And that's the truth. And this is the way that we have face it here in Chile. I think that companies are much more open even to taxes than to marketing controls, because really moving into what Corinna is saying, a plain package, as Laura was saying, it probably means ending the rationale for competition, for selling different kind of products. And what we have seen in Chile is that marketing doesn't disappear. And that's something to be taken into consideration. It just switched into other type of products of the same companies. And what we have observed is that there is a decrease in the regulated, in the promotion of some regulated products, but an increase in other type of products. So I think that going back to the question of how we make allies, how do we create codes, I think that if we really want to make progress, we should start to be thinking that we have to put a limit to the creation of demand of unhealthy commodities. And we need to be strong enough to be putting that into the table with our friends economists, and putting some boundaries to the model that we have defined for growing. And I think that that's very relevant, particularly for low and income countries that struggle with this from an economic perspective. And I think that we should be open to this discussion as we are now starting to discuss it in the sustainability arena. So I think that basically we think we should not be creating demand for unhealthy commodities without any restriction. And those are the boundaries of growth. So I think we should move into that discussion as well. And in that discussion, we should be allies with tobacco and alcohol. So yeah, some reflections.
Thank you a lot for these comments. I want to highlight the fact that despite there are pros and cons, this discussion deserves to continue to explore opportunities as it's happening with taxis, for instance, but acknowledging the difference between tobacco, alcohol, and food. So it's not an easy decision to take, but it's a discussion that needs to continue. But also I want to highlight what Corinna mentioned about formula milk, because in my opinion, that is something simpler to incorporate in the marketing restrictions of food. And not necessarily we see that it's happening in many countries when it's really baby food and formula milk. Most of us, I think, will agree that should be incorporated more systematically in marketing restrictions of unhealthy products. So this is something to continue. I wanted to ask a question to the panel, summarizing at least 10 questions we receive about digital marketing. We have questions like, if any of the panelists want to talk about how to control social media marketing, similar questions like how can social media restrictions can be implemented, monitoring, and be effective to reduce exposure. So what the panel has to say about digital media and how to control it, if we have experience, standards, etc. Fernanda?
Yeah, well, this is a very complex question, and actually I have some ideas to share, but I think we need to work a lot on this. I think one approach that is very important is restriction to all the information about privacy and children, and all the information companies are getting from our behavior in internet. So that is kind of like a huge area which is related to all the way that internet works, and that is a discussion that is not only about food marketing. There is a lot of issues related to all the information we are giving and the companies are capturing, and the inability of children to understand that, and also the inability sometimes of parents to understand all the conditions they have to read before entering to a site or whatever. And then to the rest, like I think in the same way that I was saying before, we need to find different strategies to reduce as much as possible exposure. So one part is paid marketing. So when a company paid an advertising, they have to decide in which time in the day they want to put it, or with what is the target. So there are some opportunities there to put restrictions. Also, we could put restrictions to companies, because all the advertising that is part of social media, so the profile of a brand is not paid, so we cannot get information about it. But we could ask to have some restrictions to companies about the profiles and the type of marketing they do in their own sites with the community managers and etc. And in that way, we need to find complementing strategies. But it's very, very challenging because it's not as simple as television. Let's put a ban from 6 to 10 p.m. Here, there is the content. It is in internet and can be seen anytime. So all the way that companies are engaging with children and adolescents, that they create content and they share it, and all the interactions are very persuasive. So we need to advance in that. And if some of those things are very difficult to ban, at least we should ask companies to have some accountability. So maybe we should also advance in some transparency of what are their marketing practices. And at least with that, we can get at least some information if we cannot ban it yet. But I think it's a very, very difficult topic, and I guess other people from the panel can add more.
Thank you. Any other comments? There were some specific comments for you, Corinna. Yes, please go ahead about experience in England about digital marketing.
I saw the question about the UK situation, and yeah, in April of this year, the legislation was passed to restrict online paid for online and unhealthy food. It's defined as high fat, sugar, salt foods in the UK. So that was fantastic news for the hard work putting into getting that adopted online. Unfortunately, a month later, because of a political situation with our government, the Prime Minister decided to delay that by 1 year, which is extremely unfortunate, to say the least. But one of the things that's really noticeable about it is that while the initial consultation was in June 2021, it was a very evidence-informed restriction, that the details still haven't been worked out. So while it's clear that it's paid for listings, online display advertising, online video advertising, etc., they've been listed out, actually how it's going to get done still hasn't been worked out in the details. And I think that does indicate what a challenge this is. And I was at a forum the other day when I heard someone from the food industry say that they were prepared for the other regulation in the UK, which is a restriction on promotional activity in supermarkets. And they'd sort of worked out how to respond to that. And were ready for it, but they were completely not ready for how they were going to manage to reduce it online, which I think is an indicator from an industry perspective that from their perspective, like working out how to do it is complicated. So if it's complicated, it's not complicated in the sense they could just do it overnight if they wanted, but it's an indicator that it's a much more complex space in which to regulate. It's a very important space in which to regulate, but it is also a complex one. And I think it'll be very interesting to see how it pans out in the UK over the next year as they start to plan and figure out how to implement it. And I hope that the world is watching and putting pressure from beyond the shores of the UK to ensure that regulation does indeed is eventually implemented in January 2024.
Thank you, Corinna. This is really helpful. Camila?
Yeah, I wanted to comment that, of course, there is a lot of debate on digital media right now because that's how marketing has switched recently. But we in Chile have the idea that, and we have discussed it, that there are tons of options for marketing products. And it's an unending story again. And probably if we are able in some way to regulate digital media, I'm very positive that they will find other ways of promoting products in other channels or in other settings. So something that we have discussed a lot with Fernanda when you try to move into policies is that maybe we should be thinking on the corporate side, not the channel side. And trying to restrict or monitor or define amounts of funding that are allocated to unhealthy commodity marketing, irrespective of the channel or the way that you want to do it. Again, I'm bringing back again this discussion that maybe what we really need to establish is a threshold of the amount of marketing that we will accept for unhealthy commodities. Ideally, it would be null, but maybe we can progress. And we have been discussing a lot that maybe we should go into the corporates and say, okay, I don't care if you do it like television, whatever, but you are not allowed to, I don't know, spend this much, or that's the way that we should be monitoring. From a monitoring perspective, from a governmental perspective, really monitoring marketing restrictions, it's impossible. It's very difficult. It's very difficult to regulate. I mean, it's very difficult to pass a law. It's very difficult to monitoring the compliance of the law. In Chile, the experience is that we have about 20 to 30% non-compliance. And in some cases, it's just because if you see different people, they will say that they're complying, and others will say that they're not complying. So it becomes very tricky when we go into that kind of details. So maybe we need to be thinking in other ways to really shut down the overall marketing strategy and going to the source and thinking what are the possibilities. I think that in doing that, we will need the help of lawyers and policy, public policy people, but I think we need to start thinking in more upstream type of regulation, because it's really the unending story if we try to cut the different channels and venues.
Thank you a lot, Camila. This is really useful, and we put a tick in this topic about digital marketing as one of the topics that need more conversation and follow-up and research and discussion between researchers and advocates. I am only going to do only one more question to the panel before closing remarks. The question summarizes a couple of questions in the chat. And it's a little bit provocative according to the current paradigm. And I think it's really important if we should continue using nutrient profile models to define the threshold for products that should or should not be marketed. If this is the best way, or if according to evidence and looking at the challenges and loopholes with substitution from sugar to sweeteners, or loopholes in the nutrient profile models, a lot of unhealthy products are allowed to be sold in schools or marketed because the best standard we have been used until now are the nutrient profile models through FOPL or individually. So do you think there are some other potential short answers, please, because we are almost over time, but do you think any reflection about potential different methodologies to define a threshold or criteria for marketing restrictions? What do you think about that? Laura?
Sorry, yes, thanks. Well, maybe I'm not an expert on the nutrient profile model and all that, but I would say, I guess that's also something that's developed at country level, right? So there are probably different high standards on that from country to country. And I think one solution coming from, for example, a child rights perspective would be that whatever type of model you use sort of to base marketing restrictions on should be in the best interest of the child. So you would really think of what is the most effective in terms of preserving the health of the child and preserving sort of the effects, of the marketing ultimately reaching the child and having a negative impact on it. So I think if you take this sort of as the overarching thing, then one can think about how nutrient profiles could be standards, but maybe complemented with others and so on. But sort of having this as the orientation and deciding on what could be the basis.
Thank you a lot. We will continue this conversation. I wanted to close this event saying, first of all, thank you for all the panelists, for this amazing group of women with a lot of experience in advocacy, research, and highly committed with public health and the right to food and experience in marketing. So thank you so much. Thank you to the audience for participating. And I would like to close this event with a proposal that Corinna made at the very beginning of the webinar, talking about the possibility to develop a global network of advocacy and research to nail down the best standards for marketing restriction. I agree with her that we really need these kind of discussions in the framework of the food policy program, together with our other global partners that work together with the Incubator, the UNC University of North Carolina, O'Neill Institute, Vital Strategy, and with the support of Bloomberg Philanthropies. As part of the food policy program, we are very much concerned about the marketing standards. So I take this idea from Corinna with the idea to propose for the future to create this global network or working group to improve the standard and discuss all the relevant topics you highlighted today to improve the regulations and legislation to protect the population, particularly those more vulnerable for unhealthy products marketing. So thank you a lot again, and I'll see you soon.